Hi, my name is Rai Karasha and I'm a third-year nursing student. Today I will demonstrate how to reconstitute, dilute, and administer an IV medication via a mini bag. So I've already compared my physician's order against my MAR and I've pulled up my medication from the Pixie's room. So now I'm just going to compare my medication against my MAR. So this is Regina Phalange, the patient, and she has no known allergies. The medication is penicillin G sodium, 3.5 million units, IV every 4 hours. The time right now is 1800. So I'm gonna do hand hygiene. Now before I reconstitute, I'm going to check for the integrity of my medication, make sure that it is not expired and that it is not broken. So for reconstitution, I'm going to look at my drug monograph, and this is the penicillin G sodium, and this is an antibiotic which is appropriate because my patient has endocarditis, which is an infection. I checked that this can be given by a suited nurse such as me. So the usual dosage is 1 to 4 million units, IV or IM every 4 to 6 hours. Maximum single dose is 5 million units and the maximum daily dose is 30 million units. Doctor's order was 3.5 million units, and since this is within the usual dose range and under the maximum single dose and under the maximum daily dose, I know this is safe to give. I'm also going to note the potential hazards that come with this drug, such as sodium overload with high doses. So I'm going to monitor for signs and symptoms of that, such as confusion, thirst, or muscle twitching. Now for reconstitution, it says on the monograph that I would have to add 8.2 milliliters of normal saline for a final volume of 10 milliliters and a final concentration of 500,000 units per milliliters. So I'm going to get my normal saline. I'm going to swab for 30 and let it dry for 15.
Now, because it's CPAP, I need to further dilute 10 milliliters. So we already need the vial, so I 10 milliliters minus the 1.6.
Swab for 30 again, let it dry for 15. While I let it dry, I'm going to set up my syringe.
Grab the normal saline, make sure it's not expired.
I'm going to pull up 8.2 milliliters of the normal saline.
Again, attach this to my blunt film, making sure to maintain the sterility of the syringe.
And I'm going to tap to get rid of the air bubbles. Make sure it's 8.2. So now I'm going to add this on my medication.
That's what I'm getting wrong. How many minutes is that?
This place.
So now I'm just going to pull up some air so that I have
Did you check your swabbing? If you're swabbing it
like every time you have
So at this, I'm going to roll my medication gently again between my palms so that the medication is well mixed. I've also calculated the volume that I have to draw up, and I've calculated it. I took my order, the doctor's order, which is 3.5 million units, and divided that by the stock dose, which was 5 million units, and multiplied it by the final volume, which is 10 milliliters, and I got the volume of 7 milliliters, and this is how much I have to draw up. to grab 7 milliliters.
I'm rushing. Is it obvious on my...
Now that I've got 7 milliliters, I'm going to tap to get rid of the air bubbles. At this time, I'm going to do my second med check. Take this syringe. So this is still for the patient Regina Phalange, and this is the penicillin G sodium, 3.5 million units, and I've drawn up those 7 milliliters. And this is to be given IV in every 4 hours. The time is 1800. Now for dilution, I'm going to refer to the monograph again, and it says that IV push is not recommended, so I would give this IV intermittent. And it says to dilute the dose in at least 25 to 100 milliliters normal saline or D5W or normal saline mini bag, and to administer this over 30 to 60 minutes. So I chose to dilute this medication in 100 milliliters normal saline and run it over 60 minutes. Normal saline because the currently infusing line is already normal saline, so I know this is compatible. 100 milliliters because I want to decrease the risk of the patient getting fluid or electrolyte imbalances. And 60 minutes because this is the first time the patient is getting this drug, so I want to make sure that I can prevent any harm should it occur. So I'm just going to swab the injection port for 30 seconds and let it dry for 15. Going to dilute. So I'm going to just mix it like so, invert it. At this time, I'm going to write my label. So this is still for Regina Phalange, and this is the penicillin G sodium, 3.5 million units, 107 mils. Diluent is 100 mils. I would write the date and the time and my signature. I'm also going to calculate for the infusion rate, and I've calculated the flow rate to be 107 milliliters per hour, and I'm going to write that on my label as well. So now that I've done this, I'm ready for the bedside, and I'm going to grab my MAR, my mini bag, and alcohol swabs, as well as my secondary tubing, and the label for the tubing as well. So I'm going to the bedside. As I walk in, I'm going to do my safety check, make sure that nothing is on the ground, that the patient is not in distress, and I'm also going to do the hand hygiene at this time. I'm going to introduce myself. Hi, Miss Phalange. My name is Raika, and I'm your student nurse for today. I'm going to be giving you your medication. I'm just going to check your armband here. Can you please state me your name and your birthday? And do you have any allergies that we need to know about? No? Okay. So Miss Phalange, I have here your medication, and this is the penicillin G sodium. This is an antibiotic, and it's to help with your endocarditis, which is your infection. Side effects of this medication include nausea, vomiting, or diarrhea. I will have the call bell within your reach, and you can just let me know if you're feeling any of that. I'm also, before I administer, I'm going to check your IV site, make sure that it is okay and that there is no pain, no redness or swelling. I'm also going to check the currently infusing line, make sure that it is running and there are no occlusions, no kinks.
To ensure that everything is going smoothly.
At this time, I'm going to do my third med check. So this is for Regina Phalange. She has no known allergies, and this is the penicillin G sodium, 3.5 million units, and to be given IV and every 4 hours. Time right now is 1800. So I am going to grab my tubing. Set up.
Oh, it did say that though. You did? Yeah. Okay, what else though?
That was the only thing that I thought. You said it, so we're good.
I did say it right after my
Going to spike my bag. And I'm keep making sure that these ends are sterile. Not to touch them.
but oh well, I guess we still have like
I'm going to connect the secondary tubing on this port before my Baxter pump because I want this medication to be regulated by the Baxter pump as well. So I am going to swab the port first.
I think that this one was
For 30 seconds. Let it dry for 15. And I'm going to, and while I connect it, I'm going to keep in mind that to keep these two ends sterile.
and like if you did, it wasn't just
Going to back prime.
we have more. Yeah, I think we signed up for 2 things. Okay.
So I'm just gonna. Now I'm back priming to let the fluid flow and get rid of the air bubbles from the tubing. I'm going to fill the chamber 1/3 to a half full. At this, I'm going to put in my infusion rate now, and it calculated it to be. The rate for the secondary line is 107 milliliters per hour, and the volume to be infused is 107 milliliters. I'm going to confirm that.
Also, I can't figure
Going to keep to make sure that the clamps are open. And I'm going to observe for 3 drops. And then I'm going to document on my MAR that I've given the medication. And I will let my patient know. Miss Phalange, I'll be back in 15 to 30 minutes to check up on you. Make sure that you're not in distress or you're feeling no pain. And I'm gonna make sure as well that the medication is infusing well. In the meantime, if you're feeling any of the side effects I've discussed with you, I will place the cobble within your reach, and I will let you, and you can just let us know.